COVID-19 for the entire state of Maine for today, Wednesday, May 19th, 2021. I'll kick us off by talking about the epidemiology and a little bit about masking before turning things over to Commissioner Lambrew before we then turn to some questions. I begin today's update on an unfortunate and sad note. State of Maine has received the reports of 2 additional individuals who have died with COVID-19. Both were women, one from Waldo County, the other from York County. One was in her 60s and the other was in her 70s. Their deaths bring our total number of deaths in Maine associated with COVID-19 to now 807. We'd like to take a moment to offer our condolences to the friends, family members, and communities of both of these women, as well as the other 805 who have passed away related to COVID-19. Overall, across the state, there are now a total of 66,315 cases of COVID-19, an increase of 202 since yesterday. One note there that I want to pause on is how things have changed with respect to who is getting COVID just in the past 4, 5, 6 weeks. For example, since April 1st, 45% of the new cases of COVID-19 diagnosed since April 1st are among individuals under the age of 29. I want to say that again. Almost half the cases of COVID that we've seen in the state since April 1st, almost half are in people under the age of 29 and younger. That's a stark change from where we were before vaccinations, where the bulk of new cases were being made up by individuals in their 50s, 60s, and 70s. As we've talked about during these meetings, COVID-19 is starting to affect younger people far more systematically, which is all the more reason for folks in that age category to start getting vaccinated. Cumulatively, we've had 4,993 cases of COVID-19 among healthcare workers. And again, cumulatively, 1,957 people have been hospitalized. Right now in Maine, 107 people are in the hospital with COVID. 41 of them are in an intensive care unit, and 20 of them are on a ventilator. That number too has come down, as have our case counts, but there is still more work to do, particularly around getting folks vaccinated. In terms of testing, there too, we've seen some degree of improvement. Our 7-day PCR test positivity rate now stands at 2.15%, and our PCR testing volume stands at 450 PCR tests for every 100,000 people. Turning now to vaccinations. For the entire state of Maine, all 1.344 million of us, more than half of the state has now received at least their first dose of COVID-19 vaccine, 50.6% of the state to be precise. And 48% of the entire state, 0 to the top end, has gotten the shots they need. If we just zero in on those who are eligible for COVID-19 vaccines, that is to say those who are 12 and above, 57% of those 12 and above have gotten at least 1 dose, and about 54.5% are done with their COVID-19 vaccination series. Taking a moment now to talk a little bit about the group that's most recently eligible, those adolescents who are 12 to 15 years old. So far, as of this morning, we've provided first doses to 8,462 adolescents aged 12 to 15 years old. That's strong progress, given that the vaccine was just authorized for that group just about a week ago. So in the first 6 days of vaccination, we've gotten about 8,462 doses on board, and we want to keep that up. And finally, before I turn things over to Commissioner Lambrew, I wanted to take a minute to talk with everybody about masks and mask wearing. In the past 4, 5, 6 days, there have been a number of changes, starting with changes by the federal CDC, which then trickled down to Maine. And we've seen and heard a lot of questions from folks about masks. Right now, as a state, as a country, we are in a transitory period when it comes to COVID in general, and specifically around masks. And transitory periods can sometimes lead to questions. And so I want to take a minute today to talk with everybody about how to think about masks. As we've noted, Governor Mills's executive order focusing on masking, the mask mandate, goes away on May 24th for all but schools and childcare settings indoors. But where does that leave you? How should you think about the CDC's guidance, which came out last week? What is the right thing to do from a public health recommendation perspective? And how should you navigate these questions? I want to take a minute to provide as much clarity as I can around this set of questions and help you think through from a public health recommendation perspective where you should be going and where you should be wearing masks. The first question to ask yourself is a straightforward one, which is, are you vaccinated? If you are not fully vaccinated, then I recommend you wear a mask anytime you are in an indoor public setting. But if you are fully vaccinated, the second question is, where are you going? And even if you are fully vaccinated, if you are going to a healthcare setting, or you're going to be on public transportation, or if you're going to a school or a daycare, wearing a mask is a good idea from a public health perspective. The last question to think about is, again, where are you going? And in particular, are you going to a business that requires everyone to wear a mask, whether or not they've been vaccinated? And if the answer is yes, if you are going to a business that requires everyone to wear a mask, then you wear a mask. Now, I know that seems complicated, and I know that there's you almost need one of those flow charts to think about it. So let me try to distill it down. Principle number one is to be smart, to be respectful, and be considerate. Recognize that not everyone is where you may be right now during this transitory period. Some people may be comfortable chucking their mask and going outside without a mask on, or going into places because they're fully vaccinated without needing to wear a mask. Others might not be. Others may not be where you are. And so again, principle number one, do the things that Maine people have done throughout the pandemic. Be smart, be respectful, be considerate. Principle number two is to ask yourself two pretty straightforward questions. Are you vaccinated, and where are you going? If you're vaccinated, then if you're going to an indoor public setting, you may not need a mask unless you're going to a school or a childcare. And if you're going somewhere that requires you to have a mask on, regardless of whether you've been vaccinated, well, those are the rules that you've got to follow. Now, these things may change depending on what the US CDC does, but for right now, this is where we are. And I wanted to take a minute to try to walk through that and make sure everyone's got as much clarity as possible. With that, I'd like to turn things over to Commissioner Lambrew.
Thank you, Director Shah. Starting this afternoon, we are opening up a new opportunity for people to get shots. We are posting an online application that any organization, be it a school or an employer, a VFW or a church, can use to request an on-site clinic if they have at least 10 people who need a vaccine. This option is offered to organizations and people free of charge. We will connect interested organizations with vaccinators, and we hope that we will be able to have these vaccine clinics in remote parts of the states or in communities where the vaccination rate is low. We are excited to offer this new opportunity, and it's yet another example of how we are at this phase of vaccination where we're not just expecting people to come to sites, we're trying to move those sites to where the people are. I'd also like to take a moment to highlight an announcement made by the Department of Education on Monday. Previously, we've announced a partnership between the Department of Health and Human Services and the Department of Education to support weekly pooled testing for COVID-19. What that means is in schools who are participating, there'll be one pool per classroom of samples that will get tested. And if that pool it contains a positive COVID-19 indicator, then all the people in that classroom will get an individualized test. This is one option that allows us to early identify and isolate people who have COVID-19 and keep our classrooms and schools safer. Newly, though, we announced on Monday that schools that are participating in pool testing, with at least 30% of their school staff and students in this program, can move from a 3-foot requirement in classrooms for children to a 3-foot recommendation. This is because when you begin to layer on top of different risk mitigation measures, a powerful one like pool testing that allows more engagement, more children to be in classrooms, and more in-person learning. There's also a benefit for those students because should the parents sign those consent forms and should those students participate, they don't necessarily have to quarantine or miss those after-school activities like they otherwise would have because of this innovative testing program. So we are excited to be able to announce this new option for our school districts in partnership with our Department of Education, and we're hopeful that we are on a path for going into this fall, having every child have the opportunity for in-person learning. So with that, I'll turn it back over to Director Shah for questions.
Great, thank you, Commissioner. We're going to turn to our colleagues in the media. The first question for the afternoon goes to Joe Lawler.
Yes, hi, happy Wednesday, and thanks for taking our questions today. I guess my first question is, we were looking at the data and noticed that for Maine people 16 and older, 65%, almost 2/3 have gotten either one shot of Pfizer or Moderna or a single dose of J&J. Do we have any sense of what, for this population, of what the ceiling might be? I mean, that's a pretty large amount. Do we think we could get to 80, 85%, or is there like a realistic estimate of how high we can go?
Well, I'll start. And Joe, I know you noted 16 and over, but of course now with the eligibility having expanded, we're looking at 12 and over as well. But our goal, of course, is to get as high as possible. Practically, our goal is to ensure that every single person in Maine who wants a shot can get access to a shot as quickly as possible. We'd like to take that number as high as we can. Now, as we've talked about at these meetings, epidemiologists have different numbers for what that should be in order to achieve some degree of population level immunity, whether it's 75, 80, 85%. Joe, as you know from our conversations, there's not one number that a state or a country needs to achieve. It's different for different places, depending on a number of factors like density and all sorts of things. And so that's why we're trying to get as high as we can. But it's not as if we've got a number on the wall where if we've hit it, then we'll unfurl a banner or something of that nature. We want it to get as high as possible. Maine is in a very good position relative to just about every other state in terms of our architecture to get shots into arms. Initially, that relied upon high volume public facing vaccination sites. But now as we transition to going on site to doing the smaller types of clinics that the Commissioner Lambrew noted, I think we're retaining our good posture.
And I'll just add that while we are proud of our progress in vaccination, today's case numbers by themselves are an indication that we have more to do. We have pockets of people who are still getting COVID-19. We still have people in the hospitals, and there is a solution for that, which is to get a vaccine. The vaccine is proven effective. We've seen people get it. We've had very few side effects or breakthrough cases. So we really do urge people to get vaccinated, which is a good reminder that in addition to these new options that we are hosting, we also will remind people of our incentive program. People who get their first shot between now and Memorial Day can get a free fishing or hunting license, a free ticket to a Sea Dogs game or an Oxford Plains Speedway race, or can get an LL Bean gift card. So we do encourage people, if they weren't going to get vaccinated for health reasons, for their families, for their children, you have another incentive, which is you might be able to get into the great outdoors in Maine as a result.
Okay, that actually is the topic that is for my next question about the incentives. Do we know yet how many people are taking advantage of these incentives? Do we have numbers for them? I know the program just started a week ago, but then also I'm just wondering if Ohio has reported some success with their getting higher numbers of people, more interest in getting lots of people vaccinated after they announced their lottery program, $1 million. But I'm wondering if Maine is considering, maybe if it's not exactly that, I mean, something that would be a bigger prize, so to speak, to maybe generate additional interest. Thank you.
Sure, Joe. I'll start with some of the numbers. As of this morning, there have been 1,739 people who have taken advantage of the incentive program, who have availed themselves of the gift card or the free entry or the park passes. So that's, again, as you said, just a week in, we're at 1,739. As to the latter, I'll let Commissioner Lambrew speak to those.
We're open to looking at all different types of options for people to have incentives to get a vaccination. We are trying to avoid some that may have some downsides associated with it. So we do continue to try to focus on those that reinforce healthy activity like fishing or going to a state park, visiting the Maine Wildlife Park. So we are going to try to continue our effort to align our incentives with other behaviors or other activities, I should say, that will hopefully advance those individuals' health as well.
Thanks, Joe. Over to Jessica Piper next.
Thank you, Dr. Shah. First up, I wanted to ask about the business checklist, which Commissioner Lambrew mentioned last week. We're going to be winding down. I was wondering if you had any updates on that process and if there were going to be any new requirements for businesses, like new signs saying masks must be required if you're not vaccinated or something like that.
So I will just repeat what we said last Friday. We are in the process of retiring the Maine COVID-19 prevention checklist and referring businesses, other organizations to the US CDC guidelines. US CDC has stepped up in issuing guidelines, and so we think that having their guidelines be the dominant ones makes sense at this point in the pandemic. But I do want to make it perfectly clear that what we announced last week, which is following the US CDC guidance, does mean that we will be eliminating the requirement to wear a mask indoors in Maine. That will be the two areas where that will continue to be required will be schools and childcare settings. And there are federal requirements as well. Some of them relate to transportation. We've seen rules for healthcare settings, long-term care settings. So there will be other places where this face covering will remain a requirement even for people who are fully vaccinated, but the state of Maine will not be asking businesses to enforce the recommendation from the US CDC that people who are not vaccinated wear a mask.
All right, thank you. And then I wanted to follow up. You mentioned the pooled testing for schools. I was wondering if you had any numbers yet as to how many schools had hit the 30% participation mark?
Yeah, so we just began the program last week and we're onboarding schools and students as we speak. So I don't know off the top of my head if any of the schools are at that point yet, but we'll be working with them. This is a policy partly for the remaining few weeks of this school year, but also for the fall. We know right now our school districts, our parents, our towns are making decisions about the budget for the fall, budgets for their schools for the fall. So we wanted to put this out there because, as a reminder, we probably won't have a vaccine authorized for children under the age of 12 going back in the fall. And so giving this early lead time so schools can plan to have more degrees of freedom in the classroom with the relaxation of the 3-foot requirement with implementation of a pooled testing program, that's the kind of, adjustments we're trying to make sure that we are listening to our parents and teachers and school leadership as we try to figure out what are the barriers to in-person learning and how can we protect people while removing those barriers.
Jessica, one note on you mentioned the 30%. I wanted to let folks know our goal is to get participation as high as possible. We would be thrilled if the schools that participate were regularly testing 70, 80, 90, even 100% of their students. That's our goal. It's just that the 30% mark is where we might start to see some epidemiological benefit, and that's why we set that. But we want that participation rate to be as high as possible. So 30% is the floor, by no means the ceiling.
Thank you.
Let me turn it over to Patrick Whittle next.
Thank you very much. I wanted to follow up on what you were talking about earlier regarding the higher prevalence in younger folks in the state. I believe you said it was 45% of the new cases since April 1 have been among people who are younger than 30.
That's correct, Patrick. That's exactly right.
Does that correlate with the use of the vaccine in that age group? Or is there still like sort of a rift between sort of age decades and uptake as of now? I know we saw that weeks ago, but I don't know where we are now.
Yep, it is roughly. I'll flip that around, Patrick, a bit, and then I'll go into it a little bit more deeply. If you are 12 and over, in your 20s, even in your 30s up and above, and you're worried that you may fall into one of those categories and become a case, you've got a tool that's at your disposal and widespread across the state today to protect yourself, which is getting vaccinated. More recently, it's true that there are vaccination rates and uptake among younger folks in Maine hasn't been as high as it was in the 60, 70, 80 plus groups, partly because younger folks were only more recently eligible for the vaccine. So we're hoping to accelerate uptake there, but there is a direct correlation between lower vaccination rates in that group and the commensurately higher rates of cases that we've seen since April 1st.
I see. Thank you for clarifying that. Is there any kind of an idea of when we might be able to see some kind of guidance about what school could look like in the fall, or is that does that continue to be contingent on progress over the course of the summer?
I think it's more the latter. And just to level set really quickly, and the commissioner's already made both of these points, but it's unlikely that there will be a vaccine authorized for children younger than 12 by the fall, hence the need to continue with preventive smart measures like pooled testing. But Commissioner, I'll let you take it from here.
We have updated the Department of Education's requirements and recommendations periodically since last July when they first got posted. We will continue to do that. I think what we're trying to do is recognize that decisions are being made in the short term about space and about staff and about other investments that schools and districts are trying to make. And so we wanted to, at a minimum, get this pooled testing option there because we certainly have heard from our schools that the 3-foot requirement was one of the challenges of having enough space to have children back into in-person learning. We're looking at the other challenges that they've raised with us to see if there are other additional ways that we could bring all kids back while maintaining their safety and the safety of those who are not yet vaccinated. So we will continue that work, but we expect this to be a work in progress as it's been in the past year.
All right. And one final thing, there's a push at the federal level to make telehealth sort of a more permanent piece of the healthcare landscape, even when we get past the pandemic. Is Maine looking to do that on the state level as well? Because it's certainly in a rural state, it's been extremely helpful for a lot of folks.
Yeah, and I would just say we are grateful for those efforts at the federal level because while we do have some degree of ability to effectuate policy for telehealth at the state level, We can, for example, set Maine Care or Medicaid policy and have been a leader in the nation on that. Our telehealth use for parts of our population during the pandemic is near the top of the nation, including children. We also can help set telehealth policy for the private insurance that the state regulates, but we can't set Medicare policy. We can't set policy for large employers who are self-insured. So we are hopeful that the leadership that our delegation and others are showing pays off, because we really could use that partnership between the state level and our federal partners to really advance the option beyond the pandemic of people, especially who live in rural Maine, getting telehealth visits, mental health, behavioral health, as well as physical health.
Thank you very much.
Thanks, Patrick. Over to Emily at the Sun Journal.
Hi, good afternoon. I am wondering if you can give us an update on how the mobile clinic in Lewiston went last week, and then at its stop in Poland.
We'll get you the precise numbers, Emily, about the uptake there, but I had the chance, as you're aware, to spend some time in Lewiston as we launched it. And I think from what I understand, it was a success insofar as that we were able to bring vaccine to a part of the state, in a city, in a neighborhood where we know access has been a challenge. And we also tried to make the hours at the mobile unit particularly amenable to folks. On certain days when it was in Lewiston, we had early morning hours as well as evening hours. We also tried to coincide the hours to make sure it was available to folks who were changing shifts. Again, we'll get you the exact numbers of how it did both in Lewiston and in Poland, but we're at the point now where success is partly about the numbers that we put on the board, but just as much about who those people are. Many of the folks that are getting vaccinated at these sites now are folks that may not have had the wherewithal or the opportunity to get vaccinated anywhere else. So as the commissioner noted, we're shifting our frame for how we think about vaccinations to focus a lot more on bringing vaccines to individuals rather than asking individuals to come to the vaccine. These mobile efforts are a big part of that.
Okay, thank you. And I'm also wondering, you've mentioned on a few occasions working with faith and other community leaders to kind of get the word out, promote the vaccine. And I'm wondering if you can give us an update on where that's at or who you've been working with.
Sure, I can start. Personally, I've worked with different members of different faith communities, some specifically in the Lewiston area in recent weeks to provide vaccine during worship services, particularly after hours, Fridays, things of that nature, when a lot of folks were going to be in the house of worship. And we work directly with the faith leaders in those communities to encourage their parishioners, their congregants to get vaccinated. I'm really proud of those efforts. I'm not going to go into too much more detail in particular. I want to make sure I check with the faith leader communities first, or even ask them to reach out to you directly, because I want to make sure I'm discussing this on their terms. But I will say that the initial effort that we took on this front about 2 weeks ago was very successful, and I was really pleased for the partnership that we saw. More generally, as the commissioner noted, the portal, the form that we're opening up, allows folks of many different stripes, faith communities, workplaces, et cetera, to raise their hand and say, we want to host a clinic, and then we will help them orchestrate that.
Okay, thank you.
Thanks, Emily. Let me go to Mal Meyer next.
Awesome.
Oh, I'm sorry,
Thank you.
Commissioner. I'm sorry, Mal.
Oh.
Commissioner, did I cut you off? I'm sorry about that. Oh, okay, good. Just making sure. Mal, over to you.
Yes, my question is about the state recently released a new COVID vaccine tracker that shows estimated vaccination rates by the zip code. How does this help providers, residents, and businesses?
Commissioner, I'll let you. I'll just say one really quick thing, Mal. Those are not estimates. Those are the vaccination rates. But just wanted to mention that. But the commissioner and I have spent a lot of time poring over those data, so I'll turn that over to her.
Sure. So it's a map that shows by zip code where we both have a high rate and a low number of unvaccinated people, and vice versa, where we have both a low rate and a high number of unvaccinated people. And the reason why we look at both of those are we're trying to make sure we target our efforts towards those places where we know there's opportunity to get people vaccinated. There may be barriers, be it distance or education or other factors that have kept people from getting vaccinated. So we have been using that map in different webinars, stakeholder engagements with our health systems to go over where are those places and who can do what in those areas, just recognizing that for some reason, there are some of these zip codes that are red, low rate and over 2,000 people who are unvaccinated, and we're trying to target our efforts towards those communities. We'll be updating that zip code map every 2 weeks. So hopefully that red will begin to turn to different colors over time, but it is one of the tools that we're using to try to ensure that our efforts are being refined to where the need really is.
Mm-hmm.
And then it sounds like those red areas are some of the areas of concern. What other trends have you been able to identify by breaking it down by zip code?
Well, there are a couple of other, and you're right, Mal, the red areas are, of course, where we're running toward first. Those are areas where fewer than 60% of the residents in that zip code have been vaccinated. And at the same time, in raw number terms, there's more than 2,000 folks. So that's where we're running toward first. Hence, and just to tie it in, that's why we're also excited to be able to launch these opportunities to go to places and provide vaccine on site. So that's the tie-in with those two. But I think the other trends, though, that we've seen are, there's a lot of places that are blue. Those are, again, places where we're not at the 60% mark, and there's also fewer than 2,000. We're going to need a slightly different strategy. We're going to need to figure out ways to provide smaller volumes of vaccine to people in those communities. One of the elements of that strategy is going to be working with doctors' offices, making sure that independent and other medical providers across the state have access to vaccine. We've been working with them all along, but now as we have more vaccine available, we're going to be working with those groups a lot more to make sure their offices are equipped to offer vaccines in those blue zones as well as elsewhere in the state.
And then my last question is, if some parts of the state continue to lag behind, could you reimpose restrictions?
Mel, I'll start. For me, on just an epidemiological note, what drives thinking around public health recommendations, for me at least, it's less about vaccination rates and it's more about things like case rates, things of that nature. Thankfully, case rates have been going down across the state. Even in areas just a couple of weeks ago where they were high. That's a really encouraging trend. We want it to stay that way. I can't speculate about what we might do in the future, but for right now, we're encouraged by the progress we've seen.
Thank you.
Thanks, Mel. Over to Amy Brown next.
Thanks, Dr. Shah, Commissioner Lambrew. It sounds like the US CDC recommendations that people who are not vaccinated should wear masks in most indoor public settings will be completely on the honor system, except here in Maine for schools and childcare settings. Is that primarily based on the difficulty or near impossibility businesses would have of trying to enforce that? Or do we have enough people vaccinated now where if there were a handful of people at your local grocery store who were not masked and also not vaccinated, it doesn't any longer pose a significant risk?
I'll start, and just to amplify the latter point you made, Amy, I think you are correct. I think you're exactly right. I'll use slightly different words and modifiers, but I think what you said is right. Maine is about as well positioned as any other state out there to move in this direction. You're right. Even if there happens to be somebody who blends in, who's not vaccinated, who for whatever reason decides not to do the considerate and respectful and generous thing and wear a mask, the likelihood of where we are epidemiologically that person may silently have COVID and then give it to somebody who is themselves not vaccinated, it's low. It's not zero, but it's small. And that's because of our vaccination rate. So epidemiologically, that puts us in a good position. And it's again, it's a testament to the work that people in Maine have done to get themselves vaccinated and the work that providers in Maine have done to help us get here. So we're able to make these changes first and foremost because of our favorable epidemiological position.
Great.
And I'll make one small correction. You had said that we're relying on the honor system except in schools and childcare.
Right.
The policy is actually we're maintaining the requirement to wear a mask indoors in schools and childcare. It's not an honor system, it's the irrespective of your vaccination status, wear a mask indoors in those settings for a pretty simple reason. The majority of people in those settings are kids who are under the age of 12 who will not be able to be vaccinated, will not be able to protect themselves. So at this time, that is our policy, is to maintain the face covering requirements in those two specific settings because there are kids there. And we recognize that even for the 12 to 15-year-olds that are just getting the access to their first dose, with the Pfizer vaccine, your second dose comes 3 weeks later and you're not fully vaccinated for another 2 weeks. So for the remainder of the school year, very few youth will be able to be fully vaccinated. So that is our policy for the time being as we, again, as Dr. Shah said earlier, begin to look hard at what will be our policies for the fall for schools and childcare.
Great, thanks. And yeah, I did understand you. That's what I meant, that they were the exception to the honor system.
Yeah.
And then I think you probably have answered this second question, but if you wanted to weigh in about, last year, a lot of people were very worried when tourist season started. We had an influx of people from other states and we'd been doing pretty well. Are we vaccinated enough that this year people really don't need to worry about that, even though we're going to have a lot of people coming in from other places that aren't doing as well with vaccinations as we are?
Well,
I'll just begin by saying this is why Governor Mills put out that challenge. Let's set Memorial Day as our target to get that vaccine dose. We have our incentive system structure for that. We're trying to make all of our clinics accessible. We're going to be reaching out to schools as well to ensure that they have the choice of doing an on-site school clinic before kids and the school staff leave for the summer. We can do more. So we are using this period of time before summer residents arrive to see how high we can go in terms of getting our population vaccinated.
Amy, I know from speaking with you and your colleagues and others last summer that there's concern. I get that. I know that there's concern about the influx of tourists and others that will soon be streaming into the state. But Amy, I think what gives me hope, at least, is the experience that we had last summer, where we had 0% of the population vaccinated and only a small percentage of the state who had natural immunity on board. So a much different epidemiological picture. And even then, even with that much different epidemiological picture, we had a successful season with very few cases of COVID. That's thanks to, in part, because of the work that people in the hospitality industry did to get ready, to put safeguards in place. They did a lot of work to make the tourist season safe. And again, we found very few instances of folks who were visiting the state of Maine, introducing or generating outbreaks. This summer, we're in a much better epidemiological position, and we can just build on that.
Great, thank you.
Mm-hmm. Let me go to Brian Sullivan next.
Thanks, Dr. Shah. I think I have a question here for Commissioner Lambrew. In fact, I know I have a question. Any thought to the state dropping the designations aligned with the sports? And is this testing pool program that you're launching or going to keep going on with and hoping to get participation, does that pave the way for a return to something like high school football in the fall?
So we will be working on our fall guidance. We're trying to finish up getting the guidance for Monday up and out to transition our checklist. So our businesses know, exactly where to look and what kind of recommendations we have. So we're in the process of doing that. That will include transitioning from the community sports checklist that is on the preventive COVID-19 prevention checklist website to US CDC sports guidelines. So we'll be looking at how those compare and contrast when it comes to school sports. But I would note that we will, for the duration of the school year, and again, we'll reassess over the summer, continue our health advisories. We continue to plan on doing those every 2 weeks. There will be one this Friday. We currently have Androscoggin as a yellow county because of its relatively high case rate and positivity rate. That was for the 2 weeks that preceded 2 weeks ago. So we will be seeing how that looks this coming weeks. But those were guideposts or information for our school leaders to figure out what types of adjustments they make to in-person learning as well as sports this spring. So we'll continue that for the duration of the school year, assess that for the summer. But when it comes to fall sports, I think we have some more work to do.
So, my mother told me never to assume, but if I was to assume that somebody was going to partake or school was going to partake in this program, it would also afford the same ability to partake in other activities, that if you could drop the requirement for 3 feet distancing in the classroom, you could do it for something else, like on a sports field.
Dr. Shah, do you want to talk about how pooled testing interacts with quarantine and activity?
Absolutely. Yeah, Brian, and your assumption there is generally right. We think of pooled testing as having two distinct, or having benefits at two levels. The first is at the school level, which, as Commissioner Lambrew has noted, regular participation at as high of a level as possible affords schools the opportunity to move under that 3 feet, because we're catching cases if they were to occur. But the other benefit that your question touches on, Brian, that's really important, is at the individual student level. Again, one of the benefits of testing students regularly, being part of these pools, is that they can participate in extracurriculars, including sports, without the need to quarantine, even if they've been exposed. One of the challenges that we know that students have had to bear throughout this past school year, and thus parents have had to manage, is exposures within the school, which means that kids have had to be out during their quarantine period. The reason we ask kids to be out during quarantine is so that if they happen to be incubating COVID, they don't infect others. But if we're testing them on a regular basis, the likelihood that they become infectious and spread it is low, because we'll catch them through the testing. That means that for the student, one of the benefits, one of the incentives to participate in pooled testing is that they can participate in the extracurriculars that they love and not necessarily need to be out in the event that they happen to be a close contact.
And just one more for you, Dr. Shah. You mentioned earlier, I think you said 57% of those eligible in the state have gotten at least the first shot. So 43% haven't gotten the first shot. I wonder what groups aren't getting the shot, and the work that you're doing. You kind of touched on it with maybe the faith leaders, but how do you get across to those people to get vaccinated?
It's a great question, Brian. There's so many different angles and elements there, but I'll tell you one that we're really focused on. Some of some survey data and some polling or national folks who have looked at this and have specifically talked to those who are on the fence. I myself have done that with people in Maine as well. One of the questions I ask folks is, okay, you're on the fence. I understand that. You've got questions that we've talked about during these meetings. The question I ask people is, what would get you to get into the yes column, and who would that message have to come from in order for you to find it trustworthy and credible? And oftentimes what I hear folks say is, I want to hear from my doctor. I want my doctor or a doctor here in Maine to tell me that this vaccine is the right choice for me or the right choice for my kids. So we've started working a lot more deliberately with doctors in Maine to ask them to reach out to their patients and give them that message, or with doctors groups in Maine to reach out more systematically across the state to let folks know that doctors too think this vaccine is really useful. I think that's a messenger coupled with the right message that can move the needle for a lot of folks.
Thank you.
Let me go to Chris Costa next.
Hi, Dr. Shah and Commissioner Lambrew. I find myself in the situation of Patrick Whittle from a couple of days ago, where everybody's asked a lot of great questions. So just excuse me if I end up getting repetitive. Commissioner Lambrew, I wanted to ask you a quick question about the quarantining portion on the pool testing. I've reviewed some of the documents. I want to make sure that I understand it correctly. Is it that if a student takes a Binax Now test following a positive in the batch, that student is then they get a negative result on the following test? I'm having a hard time explaining this, and I apologize. Basically, I want to know how can a student avoid quarantining if there's a positive result within the batch? Is the Binax Now the only option, or can they get a different test from another source?
So let me just do a little bit, repeat it a little bit more slowly, because I do think it's important for especially the parents who are watching to understand it. So schools that are participating will be sending home consent forms, and those parents will need to sign the consent form for the student to participate. So if I'm a student in that classroom, I get my weekly pool, it's negative, I'm good. If the next week that pool is positive, all those kids will get a Binax Now test. And if that test is negative, that student does not need to quarantine. That's the difference, because currently, if I'm in a classroom and a kid in that classroom tests positive, the whole classroom generally has to quarantine unless they have assigned seating and go through a formula to figure out who does and doesn't need to quarantine. So it will be a quicker way to identify who has been affected and who needs to isolate than otherwise. And we are offering this testing paid for by the state on site, so parents don't need to take their kid to a Walgreens or some other site to get a test. They can get that Binax Now test will be occurring in the school, so they can rapidly assess whether or not that child has COVID-19 and needs to isolate or can go back to the classroom.
Sure. And just a quick follow-up. If a parent, said, I would prefer to get, a different type of test, maybe a PCR test, would that also allow them to avoid the quarantine period?
Yeah, we've talked about that, Chris, and have discussed it with some infectious disease experts here in Maine, and then conference with schools. One of the things that's important here is making sure that the test is verified, that the school has immediate access to it. The Binax Now provides those things. There's a result very quickly, and the school can see that really quickly. So for right now, in order for the child not to have to be in quarantine, that test result needs to be from a Binax Now that's administered by the school and obviously is negative. If it's positive, then you go down a different route, then you're a case. But if that Binax Now is positive and negative, then they need not be quarantined. And that's got to be a Binax Now that the school itself administers. And then these are a lot of great questions. I just want to note for everybody that many parents probably have questions out there. DOE, the Department of Education, is offering a webinar for parents on pooled testing tomorrow evening, Thursday, May 20th, from 6:30 to 7:30 p.m. And we'll circulate that link on various websites so parents can see that and register and hear for themselves how this all works in detail.
Okay, and then just one quick follow up to that, and I just more of a clarification point. So, is it that the family of a student needs to opt into this testing, or is it that the school district or the school campus needs to opt into the testing to meet that 30% threshold?
It's both, Chris.
Okay, understood. Last question for you, Dr. Shah. This kind of goes back to the numbers of the people getting vaccinated. We had been doing our best to kind of keep track of that. It looks like from late April, the number I have is April 29. And if you're looking at that age group of the 20 to 29, first doses on that day were about 36% of the that age bracket, and 17.8 final doses. Now it looks like that's jumped pretty considerably in terms of final doses, up from 17.8 to 26.4. I would imagine a lot of that has to do with, there's not quite the same commensurate jump in first doses. So I'm assuming there's a lot of J&J going on there. What's your reaction in seeing that type of jump in that age group that we know has been 45% of the new cases lately to see that jump in vaccinations.
Yeah, it's certainly encouraging. Make no mistake. I mean, that's a 3-week period, right, Chris? You said from April 1st or from April 30th?
Oh, no, I apologize. It was April 29.
April 29th. So, in less than a few weeks, we've gone up sizably. That's also, in just numerical terms, a large group of folks. So even though on percentage terms, it's impressive, I think when you look at it in numerical terms, it's even more impressive. So it's encouraging. It's certainly trending in the right direction, but we've also got more work to do there. This is the group, again, that is experiencing a high number of new cases. And they are often, folks that are now increasingly finding themselves in the hospital, which we talked about not too long ago. I think just last week I mentioned that for the preceding 3 weeks, at one of the large hospital systems in Maine, all of the people who had been hospitalized in 3 weeks, all but one were unvaccinated, and they were trending much, much younger and finding themselves in the hospital for a longer period of time because they were really sick. So we've got a lot more work to do there. Commissioner Lambrew and I are committed to making vaccination the easy choice for every single Mainer who wants a shot.
Got it. Thank you both very much.
Thanks, Chris. Over to Megan at WMTW.
Still have questions. This is like Mal Meyer's question, kind of, but it's sort of like the inverse. Looking at vaccine rates per zip code, for example, Newcastle in Lincoln County shows a 99% vaccination rate. And in fact, a lot of different areas in that county or towns in that county show a vaccination rate that's almost over 70. So what do you think is behind that high turnout? Is there something special being done in that area that would explain that high rate?
I think access is part of it. Certainly there was I know that Northeast Mobile Health did a specific vaccination clinic, which I had the privilege of visiting in that area, which the day I visited, it was booked out. So access is part of it. But at the same time, we've also taken steps in areas on the map that are red, in, for example, places in Somerset and in Oxford County, to bring vaccines there. For example, one of the zip codes that's red is Freiburg, and the mobile vaccination unit was set up there as well. So we're trying to make sure that that access is not the barrier for vaccines. As we see those areas that are red on the map, we're going to be looking for ways that we can work with providers and groups on the ground that want to host vaccination sites so we can make vaccine access not be the barrier.
Switching gears slightly, I just have one more question. For parents of kids that are younger than 12, is it epidemiologically, does it make your child more at risk? Because since the virus is so opportunistic, but doesn't really find a host in people who maybe are vaccinated, does it make children under 12 more or at a greater risk of contracting the virus?
The answer, Megan, is no. One of the benefits of so many folks being vaccinated is that when the virus tries to jump from person to person, if it runs into somebody who's been vaccinated, it may try to get a foothold, but it's not going to get very far. And so by having so many folks who are fully immunized or vaccinated or have natural immunity in our state, the risk to younger kids goes down that much further. All the more reason why we felt comfortable making these decisions or these moves. It doesn't go down to zero. And that's why, again, if you're a child, 9, 10, 11, you're not eligible for vaccines yet, wearing a mask is still a great way to protect yourself, because the masks protect you from transmitting the virus, but they also protect you or your child from getting the virus.
And I think you've covered this, but in any instance where there might be mixed age groups, even among children, it's probably advisable that everyone wear a mask. Is that correct?
Meaning some children who are over the age of 12 who might be vaccinated. But
exactly.
Yes, the answer is yes.
Okay, thank you.
Unless they're outdoors, and then less so outdoors, but indoors, yes. If bunch of kids are indoors playing video games or something of that nature, or in a school, for example, then yes, masking is the way to go indoors.
Okay, thank you.
And the last question for the afternoon goes to Charlie from Maine Public.
Yeah, hi, Dr. Shah and Commissioner Lambrew. Thank you. The first question came from one of our listeners who wanted to know so the lifting of the mask mandate for most places, except for schools and the other one, which I'm blanking on, schools. Anyways, is that an executive order from the governor, or I guess the listener specifically could not find a corresponding executive order and was wondering if that's coming or where that stands.
It's coming. We're working on it.
Okay.
We expect by the end of the week to have all of our guidance updated. Our websites do need to adjust to the guidance, so that is forthcoming.
Got it.
And
okay.
childcare.
What's that? Oh, childcare.
Childcare.
Thank you. Yeah. And then the other question is just, I know I've heard you, Dr. Shah, say a couple times that what you said earlier about physicians being one of the most effective communicators to people about the value of vaccines. But what's your latest thinking or advice for, say, a family member who has someone in their family who is reluctant to get a vaccine, or a friend or a colleague? I mean, would you recommend anything to people in that situation?
Yeah, I'll start, but again, Commissioner Lambrew, please weigh in. Jeanne, Commissioner and I have discussed this topic on numerous occasions. Charlie, the way I think about this is effective communication here requires two things. It requires the right message and the right messenger. And if you've got the wrong of either of those, the wrong message with the right messenger or vice versa, you haven't communicated with anybody in an effective manner. And so I think physicians and healthcare providers are particularly well set up to deliver the right message, neutral, science-based, takes into account risks of COVID, as well as being the right messenger, trusted, et cetera. But they're not the only group out there. Family members, as you note, can play a role. What I have found to be effective, in particular with one of my own family members, is not to turn it into a debate. If a family member comes to another family member and has earnest questions, it need not be a debate or a lecture. I think what I have found to be useful in that setting is relating it to loved ones in the family, making it about a personal family experience. So, Joan or Jim, I think you should get vaccinated because, even though you may be healthy, maybe grandma's not healthy. And maybe we need to do everything we can to provide a wall of safety for her. I think personalizing it and making it about the shared family experience is a way to get people to yes.
Okay, thanks so much.
Very good. Commissioner Charlie's question was the last one for the afternoon, so I'll turn things over to you to close us out.
Thank you. So I'll just remind people that we continue to have our mobile vaccine unit traveling the state of Maine. It will be going to Old Town next and then to Millbridge. If you have questions about where you can get a vaccine shot, you can go to our vaccine website or also call our toll-free number, our 1-888-445-4111. We have available appointments. It's easy to get. And to that previous point, why? The good news is you can ask a lot of your neighbors and your friends and families. We have the majority of our adults in Maine have gotten a vaccine, first dose or final dose. So I'm hoping that they can share their experiences and talk about the fact that it is safe, it is easy, and it is important. Thank you.
Thank you, Commissioner. And thanks to all of you for joining this afternoon. We appreciate you taking some time to be with us and hear the latest. We look forward to chatting again with everyone next week. Until then, as always, please be kind and take care of one another. We'll talk soon.